Fibromyalgia is a condition that can affect anybody, but in particular it does tend to predominantly affect women. It has a peak sort of occurrence in middle-aged, but in particular these type of patients can suffer a great deal during their normal activities of daily living. In particular, they can complain of pains in a variety of different parts of the body. It can be the legs, the limbs, it can be across the chest or the abdomen, but it can occur anywhere. But associated with this, there can be other symptoms. In particular, they can feel very, very tired. They can struggle to get through their normal activities on a normal day. But also on top of that, they can experience a kind of a brain fog, which is what they describe, where there's difficulty in concentration, possibly reading or even doing their normal work. This condition can arise as a result of any sort of stress in most cases, be it psychological stress or possibly a traumatic experience, including a physical experience. And what happens is that then basic nerves become quite sensitive, and in particular this sensitivity leads to a continuous, possibly a waxing and waning type of pain in various parts of the body. We see a large number of these patients regularly on a weekly basis, and the form of treatment that we give to them involves a multidisciplinary approach. So in particular, first of all, what we aim to try and do is to give the patient a full history and examination, making sure that we're not missing any obvious medical pathological issue. So that might involve a significant amount of blood tests to rule out these medical issues. Also, it might include some imaging of various parts of the body. On top of that, we then move to the form of treatment options that we have, and this includes physical rehabilitation with some of our physical rehabilitation specialists, such as physiotherapists, osteopaths and acupuncturists. On top of that, we provide medications which are aimed at trying to dampen down some of these pains that these patients are experiencing. On top of that, we may even provide injection therapy, in particular Botox therapy, to the particular painful parts of the body, which are very, very painful. And also, on top of that, we provide a psychological assessment, which may be able to sort of deal with any of the other associated symptoms that could be causing or perpetuating the condition. Please come and talk to us if you have these symptoms, and we can discuss this